Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Hello and welcome to the Feel Better, Feel Great podcast, where each episode we dive into the wonders of holistic health and functional medicine so that you can be aware of the knowledge you need to lead a healthier, happier life. I'm your host, Dr. Andrea McSwain. I'm also very excited to share the Feel Better, Feel Great functional wellness membership that we have, which is a deep dive into podcasts and other information that I want to share with you that I believe is easy to assimilate, process, and also change your life at the same time. And it makes me feel better as a doctor for me to be able to offer the podcast and the membership because there's so much I want you to gain at a very low cost. And I really hope that I can help change the world, reduce cancer diagnosis, reduce diabetes diagnosis, and really help improve your quality of life. So today we're going to discuss that as we are in episode 142, Understanding Inflammation, the Root of Chronic Illness. This topic does touch many lives and it will offer insights into getting into the root cause. As a disclaimer, please remember that the information provided in this podcast is for educational and informational purposes only. Please seek the medical advice of your physician with any questions you may have regarding a medical condition. All right, I'm going to introduce you to inflammation, but you've probably already been introduced to inflammation. When you were little, you fell and scraped your knee and you had a cut and it was red and bleeding and you cried, probably because it hurt. And then it got redder and swollen and then a scab formed and then new skin came and it healed and life was great and you didn't even know that you had that. Then your body grew and the tissue was healthy and strong, and that scratch or scrape never was seen again, right? And so that is an example of just our body's natural ability to mount an acute inflammation response so that we can flush out any toxins or bacterial exposure or debris that might have come. Let's say if you scraped your knee, you fell off your bike, and then it'll get swollen from all those immune response particles and white blood cells, your special soldiers coming in to fight and protect you. And then the bleeding will stop. The platelets will come in. They will create a scab, a coating, right? The serum, which is part of your blood, will come in with all these extra cytokines and, again, special soldiers, as I call them, to really make sure that that area is protected for a little while. The swelling will go down. The skin will rejuvenate and heal. Yay! So we have this natural way to protect ourselves from inflammation and injury and recovery, and that's an acute inflammatory response, and it's very important. However, we can sometimes get in situations where chronic inflammation persists, and that then leads to those issues. So inflammation is it's red, it's swollen, it's getting a lot more blood supply that might get engorged. The area gets kind of locked down because the fighting materials come in, but they can't really get out. So then tissue gets boggy and heavy, and then there's loss of function that sustains. And that loss of function isn't just in the muscles or the joints, but it can also be in organs like your heart, right? Or your gut, things like that. And that's when chronic inflammation sticks around. So it's chronic technically means greater than 6 months, but we start looking at how chronic inflammation starts to extend over months, years, decades, and that really impacts quality of life and longevity metrics. So this is an interesting idea because a lot of people talk about inflammation. There's, is it real or not real? And I think, okay, well, I guess so. But what we really see is how inflammation starts to shut down a system. And for some people, there's just more susceptibility in some tissues than others. So that can lend itself more to cardiovascular disease in some people than others. autoimmune disorders, joint inflammation, as I said. All these things that kind of manifest a little bit differently in people, but be similar in the root cause. The common denominator, which I think makes a lot of sense. So when we look at the link between chronic inflammation and disease progression, we go from physiology, so our normal functioning in the body, to pathophysiology, so a disruptive way that the body compensates to handle circumstances that can then get stuck in being the standard, right, and of how our body works. When we look at this, I can give you many, many examples. So let me talk to you about Hashimoto's thyroiditis, which is one of my favorite things to talk about because, first of all, thank you, Dr. Hashimoto. You found something a long time ago, really before there were any labs. And what happened is people got really fast metabolisms. Their eyes kind of bulged out. They were anxious. Their heart was racing. They couldn't keep on weight. And then they were going 1,000 miles an hour. And then all of a sudden, they went from that velocity and they basically reversed the velocity into a slow, sluggish, fluid accumulation, brain fog, just everything awful. Well, that was the thyroid. At first it got inflamed, so it got activated, and then it retained the fluid. It created glandular destruction and inefficiencies in the thyroid. And then that meant the thyroid couldn't function as well. And so that inflammation became chronic. And then everything opposite happened from hyperthyroid and it came hypothyroid. So hyper is active, hyperactive, hypothyroid, hypoactive, slow, hypo, they rhyme. It's a good thing to remember. And that is a fantastic example of Hashimoto's thyroiditis. A lot of times joint inflammation will happen. And so the body will have a little bit of inflammation. Usually there's like overactivity, for example, in the hands. And then the overactivity, the body will institute some inflammation, right? So there'll be a little bit of micro injury that happens in the muscles, which is actually kind of how muscles work. They get a little micro injury and the body goes and heals them. The body can do a lot with micro injury. You can use it therapeutically. So you get a little micro injury, you get a little micro insult, you get a little bit of oxidative stress, right, from ozone. We talked about that, or I presented that idea. And so you get a little micro stress. And then, cold plunging, that's a great example, right? It's a little micro stress. And the body's response is to then kind of up its game to get stronger. So you have a little micro tear of the muscles in the hands, right? And then you're like, okay, there's a little bit of inflammation. The body should be able to recover and get stronger, right? The muscles are getting used, but then all of a sudden they get swollen. The joints get swollen. The immune system markers or contents of the immune system stay in the hands, and they have to stay and they become space occupying. So then the joints don't fold as easily, right? The fingers get very tight because now the skin is much more adhesed to the underlying tissues, restricting movement. Okay, and then you have loss of function. Loss of function is a very important paradigm in pain. There's 5 elements: dolor, color, loss of function. So anyway, there's this very ancient way to explain the 5 different types of pain, or the 5 different elements of pain, and then those elements maintain themselves and into chronic inflammation. So we see, even in the Lancet, there was an article in 2019 that looked at inflammatory pathways exacerbating diseases like type 2 diabetes and Alzheimer's. So don't just think that inflammation is a buzzword, please. Inflammation is a conversation. It's an understanding. It's a concept. It's an actuality. It's a physiology that happens in our bodies. Okay? We have inflammation when we ingest anything into the gut tube. And that inflammation is designed to protect us, right? It's part of our protective repair. It's part of our it's part of our protection. It's part of our defense mechanisms. Part of the reason our immune system exists. It's just when we chronically stress the immune system as an element of inflammation that we don't have the ability to mount that immune response, to mount that inflammation, because chronic inflammation will then overtax the immune system. And that's where many diseases come into play. So looking at the idea of the how chronic inflammation develops. Obviously, how we live our life, right, means that there can be more demands on the body. Now, this sounds ironic, but for the most part, if we're not sleeping well, right, if we're not moving enough, right, if our food is unsupportive of the natural biochemistry of the body, we have exposure to pollutants, so air, water, occupational pollutants that make our body work really hard. And these lifestyle and environmental factors can therefore lead to inflammation that's persistent and requires a huge demand on our immune system. When we look at the gut-brain connection, we can think about Nature Review's Microbiology magazine from 2019, where there was an article discussing the gut's microbiome's role in the immune health. So an imbalanced gut can lead to systemic inflammation, which affects the brain and overall health. There is the gut-brain connection because we're one unit, right? So we have many systems. We're a multi-organ entity, but we really have to identify that as one unit. There's a lot of tight communication between different organ systems. So the gut and the brain inherent, the liver and the skin inherent, the liver and the lungs. I mean, basically, if one organ is having problems, it's going to push the work to other organs, and that's going to create a higher demand and a double workload, right? And then that's going to create inflammation and a stress level on that tissue. So when we look at a few different organs that I think are really important, because they're kind of like the mother lode, if you will. I mean, I really kind of want to talk about them in a way that's a little bit different, because they affect everything. So this is mitochondria, for example. So mitochondria is the power plant that's present in every single cell. So we discuss mitochondria, we're really talking about what's happening in every single cell of the body. So that's the kind of thinking I want you to recognize. When the mitochondria, or the power plant, is efficiently working, the resources that are put into it create a lot of energy. So that's like the most efficient tier of energy production. There are three tiers. There are 3 tiers of energy production in the mitochondria. There's the most efficient tier, which is fantastic, making lots of energy in a high oxygen state, making those muscles pump, feeding that fountain of youth and that inherent ability to heal. Then you get into the middle tier, right? So that's less efficient, but still doing good, but highly vulnerable, of course, to a lot of different factors and dynamics of different nutrients. It's very complicated. It's the citric acid cycle. And then you get into kind of the lowest efficiency tier, right? So it really takes a lot of resources to make very little energy. And so when mitochondria is functioning well, it's fantastic for the overall body. That's why mitochondria is a huge discussion in health and longevity. Then we look at the immune system. The immune system obviously has white blood cells. There's special soldiers or categories. There are cytokines that are part of your immune system. There's those elements affect all of our bodies. So if we get in a situation where our body has an inflammatory response, and then all of a sudden it recruits our white blood cells, and it recruits our immune system, then it obligates our immune system to that area. Sometimes the body will get over-obligated. This is particularly important in dental issues. So, a dental issue can consume or occupy 60% of your immune system, roughly. Nonetheless, that's your mouth. I mean, that's the beginning of the gut tube. It's definitely related to the sinuses. It's right by the brain. It's a big deal. And a lot of times dental health is really ignored, Or people will placate like, oh, I just had a root canal, or I had a dental infection, or I had a dry socket after wisdom teeth, or nope. Like, your mouth is really important. It can have a lot of inflammation, and it can kind of just fester there, actually. A lot of times people will have very awful systemic problems, and come to find out they have a hidden infection after a root canal, or after some kind of more difficult uh, dental procedure that happened. So, these things really matter, and they're very occupying. Then when they're occupying, you get into chronic inflammation because they're constantly requiring the immune system's involvement, right? They're depleting the mitochondria, and they're altering also pH levels, right? They're altering layers in the body. The body's very designed to have certain layers, right? The skin, the subcutaneous, the muscle, the bone, everything's wrapped in fascia. It's a highly organized system. So when things are inflamed, it disrupts the system's organization. And that's very important to blood flow. It's very important to lymphatics, obviously. It's very important to the pump of the body. And then these things lend themselves to different disease pathways within different systems. So cardiovascular. Don't just think about cardiovascular as the heart. It's very important to remember it's cardio, so it's the heart. Vascular, it's every single blood vessel, arterial or venous, throughout the entire body, and also how that water sheds into the tissue. So if the blood vessels are inflamed with something called leaky blood vessels, you're not transporting much nutrients all the way to the end of the road, right? And you're also aggravating the tissues because it's not collecting the waste appropriately. So the heart pumping is one thing, but the the vascular tubing is really imperative. And leaky blood vessels makes a huge difference in people's lives. It's very, very ignored, unfortunately. But think about the vascular health and how it impacts the entire body. So in terms of other chronic inflammations that lends itself, as I mentioned before, autoimmune diseases. Again, this is a big topic, autoimmune diseases. I think we have to recognize when people say that it's the immune system attacking healthy cells. Eek! I just don't agree with that. I think the body believes in the inherent ability to heal. I definitely think there is confusion in misinformation within the body, and that lends itself to the immune system doing the best it can, but sometimes that means making some bad decisions if things are biomimicry. So biomimicry is that they look the same. So there's just, I guess, so many things you can combine, when you put things together. And so at that level, the molecular level, so although there's a lot of very detailed information at the molecular level, there are some things that are very similar. And so the body's going to do its best to defend itself. And so sometimes biomimicry, things look so close together, the immune system is going to sometimes attack and ask questions later. And that doesn't always end up as a good thing. It's sometimes a very important thing, but doesn't always end up as a good thing, particularly if it's chronically attacking itself because of confusion with biomimicry. So again, this is a tangent with chronic inflammation and how you view your body. It is important to remember that the body has an inherent ability to heal. And I believe the body does the best that it can. And people do the best that they can in the circumstances that they're in. So these are some kind of fundamental premises that I believe, even in light of a conversation on chronic inflammation. Ooh, diabetes and obesity, which is such an important topic, that adipose tissue is highly inflammatory. We think about visceral fat, right? We think about if we're really changing the pH, which inflammation really makes the body very acidic, then we're really altering the entire body. So obesity, often producing a lot of inflammatory toxins from stored toxins in adipose tissue. So fat is an element because fat is lipophilic. It can attract a lot of toxins. It can store a lot of toxins. It will do that in adipose tissue. One of the reasons why adipose tissue is so toxic. Now, that doesn't have to do necessarily with weight, particularly in people who are highly muscular, and that alters like a BMI. So obesity and BMI, I'm not really getting into that discussion, but think about adipose tissue. So if there's fat cells, kind of that cottage cheese construction in your abdomen area, in your glute area, hamstrings, other thigh, whatever, arms. We really need to think about how we can move that out to reduce inflammation. And that has a lot to do with your lymphatic system. So obesity, lymphatic system, how that ties into inflammation and storing toxins. A lot of elements there. And of course, cancer. And as you might very well be aware, cancer prevention is a huge element of my practice. Also, cancer therapeutics or cancer care and integrative cancer care is also a huge element of my practice. So inflammation and cancer development, we look at diabetes, it's linked to cancer. Autoimmune, it's linked to cancer. All of these metabolic dysfunctions that then lead to DNA mutations, and that relationship with chronic inflammation is all together. So there's a huge startling statistic with cancer being prevalent in approximately 40% of the U.S. population. I mean, imagine hearing that diagnosis. I want people to never hear that diagnosis. What can you do today with these ideas on chronic inflammation, reducing inflammation, improving your sleep, making sure you have low inflammatory foods, healing, which is a strategy I want to get into in a minute. And I just want to look at some biomarkers that are related to inflammation. I'm going to say there's a few. One of them is C-reactive protein. This is a marker you definitely want tested. It's produced by the liver. It's definitely a marker of inflammation. Then we look at interleukin 6. There's many cytokines. Interleukin 6 is definitely linked to a lot of inflammation. It's a very pro-inflammatory marker. It was definitely related to cytokine storm and some recent viruses that swept through the world. So there's that. And then looking at, again, how to combat chronic inflammation. I mentioned a few. One of my favorite ones to talk about is tissue relaxation techniques. So progressive muscle relaxation, it definitely impacts cancer circulating tumor cells. So there's good research there. We want to relax the tense muscles to lower inflammation markers because tense muscles is about stress. So progressive muscle relaxation is actually taking the time to release the muscles. So I do this in two ways. One, yoga nidra. It's, thousands of years old. It's pretty cool. You lay there and then your brain is told what to do, right, as part of the technique, to go through every single part of your body in progressive order to let it release. So you're making your brain work to release your body. Another thing that I like to do that I use is 2 simple questions for sleep. When people want their brain to work and they should be sleeping, and I don't usually should on people, but if you're sleeping, your brain is doing other things besides worrying about whatever happens in your life, right? Your brain is figuring things out while you sleep. So you need to let it. But for people who struggle with that transition, asking questions, am I cozy enough? Right? Am I the right temperature? And so the brain then becomes occupied with creating relaxation in the body. I think this is also important with breathing techniques. I would love to talk to you more about breathing techniques in the membership. So looking at ideas about diaphragmatic breathing and how the liver supports breath and how oftentimes when people learn breathing techniques, that actually puts them in sympathetic overdrive. So they start breathing very forcefully, a lot of thoracic movement, and that activates their sympathetic. So then they lead to anxiety. I would say that's not the way to get to a relaxation. You can use breathing techniques that help you facilitate movement and muscle contracture in the thorax. I just think it's very important to recognize that that's one element of it, but you're actually using it to have progressive release of tension. If you're feeling overwhelmed and anxious when you're doing breathing techniques, they are not working. So please just check in and say, okay, my teacher's telling me to breathe like this. It doesn't make sense to my body. And that's okay because, again, we want to use breathing as a way to heal, as a way to eliminate toxins, as a way to reduce inflammation. And we can see in research, because we can test some of these inflammatory biomarkers to see how breathing techniques, when done correctly, can lower inflammatory markers like I mentioned, IL-6 and CRP. And I think that's amazing. So we get that information and we use modern technology to help us with these labs. We can see sometimes how ancient wisdom does so well at keeping us healthy and strong. And that probably integrates right into the idea of blue zones, which I think blue zones help us see how healing and the inherent ability to heal is part of our process, part of our abilities. And Healthy at 100 is a way that we can do that. And when I hear people say, I don't even know if I want to live to be 100, I can relate. A lot of my patients come in, they're really hurting. And they say like, oh, I don't know if I could be in this body for another 40 years or 20 years or whatever. And I think, okay, we have to think in our 30s, 40s, 50s, how to really create that long game. And understanding how inflammation works in the body is one thing, but understanding strategies that you do every day to reduce inflammation is a whole different thing, right? So appreciating it on a cognitive level, it's very good. So we can get a plan in place to release that inflammation, right? We can release that chronic inflammation so we can be healthy at 100. Thank you so much. I hope you get some markers tested so you know where you're at. It's always a great idea. I love doing that in my practice because I want people to understand what they're doing and see how it's working for them in their body. So labs really do matter. And there are some really good labs because of modern technology. We need to use them to see what strategies work for you. Or if you're employing a strategy to reduce inflammation, it's not working and it should work. Why isn't it working for you? What else is going on in your body? Okay, and that's okay because that's how you unravel things and get to the root cause. And that's fine. The investigation into your body is very important. Your health matters. It is dynamic. It takes work to configure how some of these things are playing out. Some things that might be small and maybe not matter to you now when you're in your 30s or early 40s, but then they keep adding a little bit, and they keep slipping away from your control and the autonomy that you have as a person to build a strong body, mind, spirit. Okay, thank you. Obviously, I want to thank my sponsor for this, Vitality Health RX. You can go to shopvrx.com and know that every single product there I use in my clinic to help people get stronger. I know how these products are going to work, and they do work. We have a discount for you on your first purchase. We'll be talking about more of the details of these particular supplements and how I vet them in my clinic, in our membership. Thank you a million times over. We are enjoying almost another year of getting into our podcasts, and your engagement and feedback makes all the difference.